I guess it's a long way of asking, do you think the doc in the room is just the token leader, or do they still have an ability to shift this rebirth and renewal?
Yeah, I love that you use the word token. I've used the word mascot, right? CMOs, yeah, CMOs are often sort of they do become, essentially mascots at times at the table, and it's unfortunate, right? I believe that they're not. You can't just sit back and say, "Now I'm empowered." Oh, this piece of now I'm empowered, right? You have to take the power.
But the times have changed. The less I say, the more my work gets done. 'Cause I live and breathe this Philadelphia freedom.
Hello, and welcome to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. I'm your host, Lee Scheinbart, and this podcast brings you the hottest and most crucial conversations in healthcare and physician leadership right now. Today's guest is Chris Deacon, a nationally respected voice on healthcare reform. Chris earned her bachelor's from George Washington University in D.C. and later earned her J.D. from Rutgers Camden School of Law. A former Deputy Attorney General and Special Assistant Counsel for the Garden State, Chris ultimately served as a senior official in the New Jersey Department of the Treasury. There, she led procurement and policy for the state health benefits and school employees' health benefits programs, covering more than 820,000 public sector lives and representing one of the largest health plans in the country. A self-proclaimed healthcare leader and truth teller, Chris left state service in 2021 when her moral compass pointed her in a different direction. Frustrated by a system rigged against patients, taxpayers, and public servants, she has since dedicated herself to speaking hard truths on stages, on podcasts, and in the halls of Congress about the healthcare status quo and the structural forces that keep it broken. Chris, welcome to the show, and thank you for being here.
Thanks for having me. I'm excited to do this interview.
This is really fabulous because what I didn't know is that you're in the UK right now, and I've always imagined you a Jersey girl. And how is it that you ended up in the Garden State, of all things?
After law school, which, I went to law school in New Jersey, met my husband, and in typical fashion, we settled where the jobs were. And 20 years later, raised 3 kids. And miss it.
Here, so I lived in East Windsor, which is near Hightstown outside of Princeton. You know the area, right?
Yes.
And I spent a lot of time down ashore, as they say, right?
Yes.
You've been down ashore?
Down the shore, I think is the correct, yeah.
Everybody says it a little funny. But, we were talking before the show a little bit about the Philadelphia Phillies, right? So I was a big Phillies fan growing up. And then when I went back to the shore as an adult, also went into town to watch games. And maybe we can get your thoughts later about the so-called Phillies Karen who demanded the Harrison Bader home run baseball from that dad and son, and particularly get your legal opinions about her reported job loss and privacy following the viral video explosion.
Yeah, it's crazy.
The quintessential Phillies universe, right?
Yes. We have
Totally.
very, very fierce fans.
Well, listen, this show is about physician leadership, particularly in today's healthcare ecosystems, which sometimes is just as crazy as that home run baseball incident. And we'll get into that lunacy very shortly. But I want to start with this. We'll take us back, take the listeners back. What was your original plan, your dream in life after law school? I mean, where were you headed? What were you thinking?
Yeah, I think that like many law students, you have sort of these ideas of what you're going to be, and certainly sitting on a bench and public service was always in my DNA. And so I envisioned that, possibly becoming a judge. I was a career law clerk for a few years after graduation. But I quickly realized that career paths aren't always linear, despite what some may think. And I always, found myself just taking the next right step for me. And it's led me to where I am today, which, I'm pretty happy with.
That there's some parallels in medicine as there are in law. You decide sort of that ecosystem you want to be in, meaning the courtroom, and physicians begin to, I want to be a family practitioner, I want to be a pediatrician, I want to be in the OR. But certainly in the world where we grew up versus the world today, nothing is linear anymore, and everything requires a degree of adaptability. So I'm really curious to hear a little bit more. I read it in your bio, and we haven't talked about it, so this will be fresh. Your moral compass began to shift along that nonlinear path. What happened to you at that time? What was going on?
Yeah. So during my time running the state health benefits plan at the state, I began to see, um, the misaligned financial incentives, that the reason status quo was remaining status quo when it came to procurement and how we were doing things in terms of, buying healthcare for our members. And I was, dedicated to changing that and bringing sunlight and transparency to the process and doing what was right for our members. I mean, it was truly, truly an honor of a lifetime to serve our public servants. But as you noted, there came a point where I could and was instructed to sort of look the other way, or I would no longer have a career with the state. Um, and I made the decision, to move on. I could no longer sort of just continue to be a part of that status quo, if you will. Um, and, at the time, I thought, there's the easy decision and then there's the right decision. But as I've gotten, you know, a little bit older and wiser, I guess, not saying I'm wise, but I do think that the right decision is always the easy decision. I can sleep at night, right? Um, Day to day may not be easy, but certainly I think that the right decision is always the easiest decision because you can live with yourself.
I agree. It is the easier, but it's also the hardest at the same time. And we've had several guests on the show, and our listeners know that. And I've done this, and I've stood up, and others have stood up, and it creates a little churn in your life and some internal and external distress. But to your point, your head hits the pillow, and it's a much better sleep than when you are not acting along that true north moral compass. So appreciate that you've been through that. Um, there's a phrase in medicine that originated outside of medicine. You've heard of moral injury.
Yes.
You colleague of Wendy Dean, perhaps, and you
Hmm.
know her work.
Yes.
So this sounds reminiscent, and it's not just confined to those who are practicing clinicians, nurses, physicians, respiratory therapists, but here you are working for the public good, and and this is a high stakes environment in the public sphere. Someone is making a request, if you will, and that's my term, to do something that is potentially morally injurious, right?
Right.
Yeah,
Right.
I just want to make sure I understood what you were experiencing.
Yeah, I do think it's important to recognize that I certainly recognize that I had the privilege to make that decision from a personal perspective. And I recognize that there are many in the system that are, unable to make such a move. And I think it's important to recognize that because there are a lot of wonderful people, as you said, who are in the system and they don't have alternatives or options, or feel that they don't, whether you're in the revenue cycle management team or at the bedside. And it's one of the reasons I feel like I take on this responsibility is because I do have that privilege, and it's something that I don't take lightly, or for granted. And so I feel like I have to use that voice because there are many that aren't in
That's
that
right.
position.
And that's one of the fascinating parts of leadership. Um, Not everybody can be or will be or is in a position to become a leader. And there are those that can and that can provide that voice, as you describe. I have a daughter who's a teacher. I have a son in law enforcement. So you're the person that they need because you can speak to these issues because they're busy. I'm
Right.
telling you, they don't have the time and the bandwidth to do what you do. So thank you for that. I'll say that publicly right now. You testified before Congress. I'm curious about what that was all about. What were you seeking to share or even accomplish as a result of that?
Yeah, I was invited by Senator Cassidy as a witness on the U.S. Senate Help Committee, so Health, Employment, Labor, and Pension. Um, I have, as you might imagine, a fairly unique background and skill set in that I have the legal background. I've actually sat in the purchaser seat, and I have also advised those sitting in the purchaser seat. And that's sort of a unique combination of experience and skills. And so when I come to a hearing, I can speak as a former sort of representative of an employer, of a public sector employer, and the challenges that they face in this purchasing environment. Again, I also have the privilege of being able to speak freely and independently. A lot of these organizations that typically represent, sort of these issues on the Hill, either they're funded by industry, or they have some relationships that they have to be cautious about disrupting. And so they have to be careful where they can go. And I'm a blank slate. I have no allegiances other than to, what I believe to be right and true.
And so let's dive into that a little bit because obviously we're seeing a crisis at the CDC, which on one side of the political spectrum is about cutting those ties to pharma, to industry, to big money. That's one side of the so-called equation. The other side, I'm not going to go there right now. But the challenge is to be an independent voice of reason, but not have the backing of the power and the money.
Right.
How do you see your voice, my voice, other voices like ours shaping change? So does Senator Cassidy sit there and take note and his staff take note and then move the needle 1 degree? Or, I mean, what do you see happening after that?
I think that we are seeing a tectonic shift that we don't quite realize, but we will in hindsight someday. I think, and I've said this, I think we're almost, in the presence of or witnessing both the death and a birth of a new model at the same time. And we'll look back on this time frame certainly as sort of that transition period or when that transition has started. The role of voices like ours, I think, it can't be overstated. And that's because we are sitting at those tables in the hearings, in the big important rooms, without that tie to money. I've never taken money from pharma or industry. And yet, this individual from New Jersey that grew up, in underwhelming circumstances is getting a seat at that table. And I do believe it's because there's an eagerness and a readiness for change. And not just sort of, the general public, but as you indicated, the clinicians themselves are suffering moral injury in the system. And I think we're all pretty desperate for a change.
So you think that in part the tectonic shift is that our voices are being heard and amplified?
In a way, I think that's part of it. I think that um, quite honestly, the murder of Brian Thompson, the United Health executive, it was tragic, but it was a great example of, really demonstrating what the public feels and what the public trusts about our healthcare system. And again, sort of the fallout of that was just mind blowing in terms of the blowback. And I think people have a lot of energy and they have a lot of anger and they have a lot of um, opinions and beliefs, but they haven't known where to direct it and where to put it. They know something's wrong, right? But they don't know quite what. And I think when the voices come to the table and sort of are pointing out, like you said, these lobbying dollars and ties at the CDC, or what some mega hospital systems are doing and spending their money on, their eyes are opened, and I think that that's part of that tectonic shift.
Yeah, that was one of the most tragic things to have happened. Nobody should expect that in the United States of America or anywhere for that matter. But the viral load of commentary was stunning and shocking to people outside of what you and I do.
Right.
Inside, we were like, yep, people have been telling me this in the doctor's lounge, in the lobby, in the hallway for a while. This is not news to us. But for the rest of, I think, general America to hear each other. Now, having said that, I agree with you. Channeling that anger to action and moving the needle is sort of maybe the next phase of how this plays itself out. Because if it's just an uprising of anger on social media, somebody died, and we need to honor, something out of all of that, and not just get all, crazy about that. I really appreciate your insights on this, and now I want to talk about the book that you wrote, because I think there's some um, relationship here. The book you wrote, The Great American Healthcare Heist, Why We're Paying More and Getting Less. What was going through? So it's one thing to work in state legislature, to testify in Congress, and you wrote a book, which is like a monster effort. So talk to us about that.
Yeah, it was, it's a book that I wrote because I wanted to be able to use that book, right? I looked for this book. I looked for a book that was putting the macro pieces together to hand to a legislator, right? One of the books that was so impactful for me early on was The Price We Pay by Dr. McCary. And I felt, I handed that book out to many people that weren't in the industry whose eyes were opened and never looked at the world the same. And I thought we needed, we needed that tool to sort of tell the picture, and sort of not just focus on one industry, not just focus on one piece of legislation, but really a macro view, again, to sort of engage, enrage, and energize people to actually fix the problem. So it's very much a problem statement book, because I think we need to clearly articulate the issues so that we can then move forward in policy and private sector and politics towards some solutions.
Yeah, I like that. The sort of the animate the language, activate and energize to action. And in the book, you call out, you have some calls to action, right? So for our listeners, there are a lot of things going on about what employers should expect, what employers are responsible to do under ERISA and everything else, and the policymakers and public rights. But I want to get inside your mind a little bit about what about providers, and we can bucket, in the government language, a provider can be a hospital, a nursing home. It can mean the individual providers like physicians. But what do you think hospitals and hospital leaders can do to energize and nudge the system a little bit? What do you think?
Yeah, I think that we need more leadership and vision in hospitals and I think that there are a lot in the provider community. But a couple things, there aren't enough clinicians, and, when I say providers in this sense, I mean individuals at the table in many rooms where, the fate of our healthcare system is being decided. I mean, Congress has a ton of, physicians and clinicians. But I can't tell you how many times I've been in a room of, let's say, healthcare purchasing coalitions, who represent the purchasing power of 160 million Americans, right? They shape healthcare purchasing in America. And I've asked the audience how many clinicians and providers were in the room, and literally gotten not a hand. And that's troubling, right? We need to have a seat at the table for those providers. And again, going back to leadership and vision, the system, from a hospital system, there are some hospital systems that are built on the premise that, the trough will keep feeding from DC and from commercial payers. But there are some hospital systems, I believe, and leaders within those systems that are committed to change and want to be a part of, as I said, I think we're witnessing the beginning of a death and rebirth of a new system, that want to be part of that rebirth. And those voices need to, amplify and be amplified. We need to reward some of that good behavior more, and stop rewarding some of the negative behavior that we see. And unfortunately, the way the system has sort of grown up, too often we're rewarding and giving financial incentives um, to the sort of behavior that we'd rather not see in the system, and not rewarding those that are doing and bringing true value. So I think, there's a role to be played there.
Yeah, yeah. What gives me agita or angina is the have not world that we seem to have created in our healthcare system. There are very, very, very powerful and strong hospital corporations, and there are those who are not, and it creates, even in the same urban or suburban area, it's shocking, the differential. And I've seen how people want to feed at that trough, and some people get the leftovers, and it's not that pretty. And if you've ever been to a public safety net hospital, you know exactly what I'm talking about. Right next door to the most gorgeous ivory tower you've ever seen. So it gives me heartburn because I think it's not clear. I like what you're saying, and I don't disagree, but that rebirth, and how do all boats rise in that tide? And so I think, to your point, I think leadership is required. I do fear that physician leaders are marginalized. You just articulated it very nicely. Yeah, we have physicians in Congress, but then they become trapped between two oaths and lots of power. The oath they took as a physician, and then the oath of office, and then the power to maintain the office. So I've talked to people in Congress about this. It's a very difficult issue. But do you think that, say, a chief medical officer working at a community-based hospital, not on the far end of, margins in the 15% billions range, and maybe just at that 1% or 0.5% margin where they're just keeping the trains running on time? I mean, are they empowered enough to advocate for these changes, for greater quality and outcomes and transparency, so that during the procurement process, the benefits folks can see, well, that they may be making more money, but they're a better hospital in terms
Right.
of their outcomes. Or if only they had more money or a premium way and they demonstrated the outcomes, we would go there. I mean, I guess it's a long way of asking, do you think the doc in the room is just the token leader, or do they still have an ability to shift this, rebirth and renewal?
Yeah, I love that you use the word token. I've used the word mascot, right? CMOs, yeah, CMOs are often sort of they do become, uh, essentially mascots at times at the table, and it's unfortunate, right? I believe that they're not. You can't just sit back and say, "Now I'm empowered." Oh, this piece of now I'm empowered, right? You have to take the power. And I've seen professionals, it's in hospitals like the kind you're describing, be proactive and go to regional employers in their communities and say, we know that you have a cost problem. We know that we have a high quality providers. Let's both win, right? And in the process, maybe cut out the 30% waste in the middle. I'm not chasing, accounts receivable. You're not having to deal with a middleman that is putting your members through the ringer. I've seen that. And it's not as a result of somebody, handing them a wand and saying, thou now has the power to do something. They took it. They took the initiative. And I think that that's what it's going to take.
I've never heard anybody express this before. I did have somebody on the show say that, physicians need to stop asking for permission. So look, to be fair, a lot of them fall into the apathy bucket, and I get that. I have worked with hundreds and hundreds of doctors, and I understand why they fall into that. But if you've been given that mantle of leadership, of responsibility, if you're an officer in the C-suite, don't ask for permission. Build your power base, wield it exactly the way you describe. We are offering you premium outcomes for the people that work in your company or your organization. You're part of government. Why aren't we having this conversation? Boggles my mind. And so we're going to have to we're going to have to bring you back to the United States to do some more work. I'm just telling you, it's going to happen.
No, I was just going to say on that point, especially when it comes to public sector, and I'll just, sort of bring my New Jersey experience to bear here. We need strong financially viable, healthy hospitals in our communities. We need that, and we want that as employers. We also want our members to get good quality health care. And so one has to think, why aren't these two parties to this transaction sitting at the table more often? And I think there's obviously an intentional middleman system that is growing by the day, right? There's almost 26 touches between just on the financial transaction between an employer paying for care and the payment actually getting to the provider. That's how many middlemen take out of that healthcare dollar. So yeah, I think it's crucial that we take that power and those conversations begin in our communities.
Yeah, and I'm going to go off on a wild, wild tangent for a second, and we'll have to bring you back to have this full dialogue. Not having a strong hospital system is not only a public health risk, it's a national security risk. And we are clearly witnessing a crisis of our public health system as we speak today. I talked to the chief medical officer in Lubbock at the Children's Hospital when the measles outbreak occurred in West Texas. To talk to her both publicly on the podcast and offline, I mean, if you want to talk about the epicenter, historians will look at that as that's when public health really broke down, not during COVID. There are a lot of issues in COVID we could talk about. But when we have low vaccination rates, providers unable to provide the care for those who are ill, and people die of a totally preventable illness, don't think for a minute that that isn't not only a national issue, it's a national security issue. You have young men and women serving in the armed forces who have not been vaccinated. I'm saying that generally. I don't know that as factual. But I mean, you can imagine a future state that becomes a bioweapon of mass destruction. So,
Yeah.
all right, I'm done with the tangent. We'll come back to reality. What do you think chief medical officers might say or do with the power if they use it wisely in a boardroom? A lot of times there was a physician or two in the boardroom. They are marginalized. Maybe they're the mascot. But then there's the active medical officer who can speak to how the board thinks about their governance. Any thoughts or ideas about that?
I mean, I think they cannot sit back and, as you said, wait and ask for permission, but they have to be the leader in that room, um, and advocate and not forget that those oaths that they took, right? And while it might be financially more advantageous to stop labor and delivery services at a certain facility, and only provide them at a more wealthy suburban facility, that is, it's detrimental to the public health, and we cannot just think about the financial side of this. And they have to bring that voice. They have to say it. I mean, I've been in rooms where it's really difficult to say the hard truth, right? And can be uncomfortable because you have community leaders, you have many congressional spouses sit on the boards of hospitals, some really powerful people. And to be able to find your voice and advocate for what's right, and never forgetting that oath and balance sort of the financial health of the system is key. I think we also need to do away with beginning every conversation at that level with no margin, no mission. I think that it's just so detrimental to the system, because that phrase that we tend to use, it doesn't cap our margin, right? Like no margin, no mission. And so we end up just chasing the margin and never actually, not never, right? I'm generalizing, but less focus on the mission. So I'd like to see that phrase sort of banished from our lexicon, or at least reworked so that it balances the two.
Yeah. And we spend a considerable amount of time talking about this tension in our Chief Medical Officer Academy. Organizations should have a mission, and they can have financial goals, but the goal of the organization should not be the finances per se. Now, I get all the Milton Friedman stuff, and I've got investments in the stock market, so I'm a pure capitalist at heart. But there's a way to drive capitalism but not ignore the mission. And you're right. I think we do have it a little upside down. We have it more than a little upside down. But yeah, I think you're absolutely right. And here's the other thing, right? I as an oncologist, whether I liked it or not, I was trained to deliver a message. You have cancer, and here's the plan, and I'm going to sit with you. And so I tell terrible things to people at their most vulnerable moment. All my colleagues have told terrible things to people in the emergency room, in labor and delivery, in the children, in the NICU. We've all done it. And all of a sudden we get into the legislature or a corporate room or a not-for-profit room where we're supposed to be about the community. And we go, I can't say the hard thing. I can't say the hard thing. Gee whiz, you've been saying the hard thing for 30 years to people in their worst moment. So we advocate for learning how to speak appropriately and accurately. And your thoughts are very, very helpful. Do you think physicians should try to get into government roles more and more? You think that would be of any help?
I do think that taking on leadership roles in public service is really important. The only thing I would, as we sort of talked about earlier, the problem is we live in a political world where the day that you're in office, you're worried about how to stay in office, right? I heard a politician years ago, but they were given advice, and the advice was do whatever, as much as you can do today, because you don't know if you're going to be in that office tomorrow. So get as much done as you can today. And I just thought how different that is from our approach, generally speaking here, which is be careful of what you do today because it could get you out of office tomorrow. And that has become sort of our primary focus. And so if we have leaders that are willing to run for office and go through that process, but then also willing to say no to pharma dollars, right? And actually stand up for what they believe is right. And, if that's the Bernie Sanders approach or that's the Cassidy approach, principle, what they believe is right, then yes, they should absolutely do that.
We are like-minded, whether we like it or not. We're like-minded, you and I. And the other thing that you didn't say out loud, and I'll say it because I've spent time in private conversations with folks, both at the state level and at the national level. Yes, they attempt very quickly, freshman congressman or a senior senator, to get stuff done because they spend 90% of their time raising money to stay in a position to get stuff done. Now, that would be like, me on the corner selling lemonade all day to treat one cancer patient. Like that makes zero sense that I have to spend all my time building my war chest of lemonade sales to give chemotherapy to one patient. So that's a problem you and I will not solve, but it is a reality. And I think on principle, they used to say, and this is probably long gone, good policy makes good politics, right? Doing the right thing on principle will stand the test of time and will give you political power. I think we're seeing a disruption of that. And I hope to God we get to a tectonic shift where power and money is not the primary driver of how you have legislative authority. But here's where we are today, right?
Right.
Right. Yeah.
I do think though that, and maybe I'm an example of that, is we assume that standing up and doing what's right is going to get us voted out of office. And certainly there are instances where that has proven true. But I think we can't just assume that that's going to happen and use it as an excuse not to do what we know to be the right thing. I had there were no promises that my career would go anywhere. And there still aren't when I left public service, but I knew it was the right thing to do. And I've just keep making the next right decision. And I think that we can't live sort of in fear of that, being voted out, or we know how this is going to play out, so I'm going to play it safe. And then that takes courage. And that's why the word courage is always sort of associated with leadership, I think.
Yeah. Yeah. So now I got to ask you the personal question. Do you really sleep good at night, or what keeps you awake relative to U.S. healthcare? Tell me the truth.
Well, it's definitely a figure of speech. In my case, I have 3 children, a dog.
All right. So sleep is a bad metric of your well-being, but what bothers you deep down in those private moments when you wish it didn't bother you, but it bothers you?
About healthcare?
U.S. healthcare.
Yes, about the U.S. healthcare system. Um, I think perhaps worrying that my hope and optimism is misplaced and that I will have spent, maybe the rest of my career, certainly many, many years, waving at the wind and at windmills like Don Quixote. Um, I don't believe that it is misplaced, but I would say that that's something that, that maybe bothers me most.
Can I give you a little counsel?
Oh, sure.
So if we take the long view, it's about our kids who are going to inherit this crap and their kids who are going to inherit this crap. And so to the extent that we're just playing a role in the larger picture, you should never worry for a minute that you're shouting into the hurricane, if you will, because hurricanes come and go. And this is part of leadership, relentlessly driving the vision that we seek to achieve and bring to manifest. And I used to worry like you did, that this is just an incredible waste of time, right? Why not get the mountain home back in Colorado and get the ranch and go off grid? Yeah, but I got kids and they're going to have kids and they're going to have kids. And it's not about me right now in this very moment. So I don't want to get too soapy or profound, but if that helps you, I hope it does. And I'll leave you with any last thoughts or commentary before we wrap.
Yeah, just to sort of riff off that, one of the things that I think about a lot in this space and life in general and making decisions and hard decisions is that mile in the dark. I might not be able to see where the mile ends, but I can see 100 feet in front of me. And if I go the right way, 100 feet at a time, I'm going to get to that mile marker. I can drive 100 miles going that way. So I think that's, I keep that in mind too.
I love that. I'm going to have to borrow that. I mean, look, if we don't speak truth to power, if we don't speak with a moral compass, all is lost. So somebody's got to take up the torch and do the work. And it might as well be you and I. We're not sleeping that well anyway. So who cares? There you go.
True.
Well, thank you. This has been an amazing and intense show, and you do tell the hard truths, and I appreciate everything that you do for public servants, for first responders, for the world in general, and making the effort to make change. That is part of leadership, and leadership is very hard, and it's better than the status quo, right? So listen, thank you again. You've been listening to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. If you want to learn more about what it is like to be a CMO, check out our website, thefirechiefcmo.com, and connect with me on LinkedIn. And yes, I do love talking with my lawyer colleagues, especially those that are partnering with you, the physician leader, to prepare us for the next crisis in healthcare. So get out there, be a chief, and in the words of Sergeant Phil Esterhaus, remember, let's be careful out there.